In this video, I'll explain to you the various types of synovial joint movements and also give a demonstration of the same. First of all, I'm gonna outline the synovial joint movement. I'll begin with gliding. Number 2, angular movements, which involves flexion, extension, hyperextension, abduction, adduction, circumduction, lastly rotation. And then there's a list of special synovial joint movements, and that is, for example, supination, pronation, dorsiflexion, plantar flexion, inversion, eversion, protraction, retraction, elevation, depression, and lastly opposition. Let's begin with gliding. Gliding is a type of movement between two nearly flat bones or flat bones, and they just slide against or over each other. That can be, for example, the bones of the couples. They glide against each other. Flexion is decreasing the angle between two bones. When I do this, that's flexion. Extension is increasing the angle between two bones. When I do this, that is extension. Hyperextension is when you go beyond the anatomical position. Abduction is movement of a limb away from the midline. That is abduction. Adduction is movement of a limb towards the midline. Circumduction involves both flexion, extension, adduction, and abduction. Rotation. Rotation is the movement of a bone within its own axis. For example, if I do this, that is rotation. Or you can do this, lateral rotation or medial rotation. Special movements, spination and pronation. Spination, when we turn the palms of our hands facing anteriorly and superiorly, that is spination. When the palms of our hands are facing posteriorly and inferiorly, that is pronation. Dorsiflexion, when we turn our foot such that the foot is moving towards the shin, that is dorsiflexion. When we are pressing down our toes, that is plantar flexion. Inversion and eversion. Inversion, when you are seated down and the sole of your feet faces laterally, that is inversion. When the sole of the feet faces medially, that is inversion. When the sole of the feet faces laterally, that is eversion. Protraction, we can use the example of the mandible. When my mandible strikes out like, that is protraction. And when I bring it back, that is retraction. Elevation and depression, I'll still use the mandible, like when I'm chewing. When I do, that is, I'm elevating and depressing. Opposition, it's the movement that allows us actually to have that power to grasp. So that is when my thumb is able to touch the tip of other fingers, and that's what gives me the power to grasp things. Thank you.